almost hard to select just one. In addition to all of the symptoms, I think one of the hardest things that I've struggled with over the years is the fact that friends and families do not really understand this disease.
My hope is to have better treatments and a quicker diagnostic.
If we cannot find a cure, at least we can manage to find specific meds to get our lives back. We deserve it.
Sjogren's is a chronic, complex autoimmune disease. Sjogren's has many phases, many clinical phenotypes, and the phenotype can change from time to time. Because they are complex diseases, many systems can be affected. HarmonicSS has generated to address the harmonization of patients with Sjogren's syndrome in several cohorts of Europe.
In the HarmonicSS project, we had the opportunity to process and analyze retrospective data from almost 7,000 harmonized patients with Sjogren's syndrome. Sjogren's syndrome is characterized by clinical heterogeneity, meaning that patients may present with very different clinical manifestations. In order to address the clinical unmet needs of Sjogren's syndrome, we were based on the harmonization process. In this way, we managed, first, to describe the wide clinical spectrum of Sjogren's syndrome and identify differences in the clinical expression of the disease among different subsets of patients, for instance, in male patients or in young patients with early disease onset or older patients with late disease onset. Second, we managed to develop models for lymphoma prediction, which is a major complication of the disease that may affect and have an impact on morbidity and mortality of patients. Third, we discovered new biomarkers to stratify patients and follow them up more efficiently.
Beyond all these things, however, the importance of having a platform like this is that we have now a tool that can be used from its clinical partner in a common way with common items to follow up patients with Sjogren's. In other words, in the harmonized platform, an item that may have different names in Scandinavia, for example, and in Greece, now have common names. Indeed, we are creating a common language for each disease component. And this is not important only for Sjogren's, but it can be used as a model for its complex autoimmune disease. So the task of harmonization of such a complex disease is not addressing only the unmet needs of Sjogren's, but give us also a serious hint on how to do the same work for other complex diseases such as complex autoimmune rheumatic diseases, metabolic diseases, or even cancer.
This is a screenshot of the electronic platform of the HarmonicSS project, where we import clinical, serologic, and histologic data regarding our patients. It is an easygoing process, although it may require some time, but since the platform will be sustained, the quality will improve and the time will be reduced. The platform offers the opportunity to collect and store large amount of data in order to conduct high-quality research.
In simple words, harmonization is to create particular ontology trees so every item in the more than 500 items used for the disease to be equally interpreted from several cohorts. Also, it is the first time in the history of the disease, but as far as I know, for every systemic autoimmune disease that we have approached, the primary care doctors are not specialized, they are general doctors, and we now know how they evaluate patients with Sjogren's syndrome. This can generate health policies for the disease that can be used later on from the regulatory mechanisms of European Union. And HarmonicSS has addressed this unmet need of the disease in all cohorts of Sjogren's in Europe. Indeed, one of the most important unmet needs is to find predictive factors of lymphoma genesis and biomarkers related to the future development of lymphoma.